This is what most people think when asked about what firefighters do. This is what the majority of the calls that the Wichita Fire Department respond to actually are. According to the Wichita Fire Department's 2012 annual report, 75% of all the department's calls were medical emergencies.
Right around the high mid-70s is percent of the calls that the Wichita Fire Department responds to are medical calls. So, out of a normal day, we're going to respond to more medical incidents than we will fire incidents.
Because of this, the department places a high priority on medical technology and training. Earlier this year, the Wichita Fire Department purchased all new automatic external defibrillators, or AEDs.
The AEDs that the department recently acquired from EMS are the new LifePak 1000 AEDs from Physio Control. The LifePak 500s that they replaced, of course, they were getting old and hard to service. I believe they probably had them for 12 years, so the technology was old in them, and it was very difficult to move the data from one place to another and get good data from them.
Technology is constantly changing. The software inside, they input a lot of different type rhythms. These have about 1,200 different rhythms that it can kind of interpret, so it just does a better job. It also has a software package that it can be used as an AED as well as a manual monitor, so we can actually see a rhythm manually defibrillated if we need to.
According to the National Heart, Lung, and Blood Institute, an AED is a portable device that checks the heart rhythm and can send an electric shock to the heart to try to restore a normal rhythm. AEDs are used to treat sudden cardiac arrest.
The American Heart used to throw out numbers that for every minute your adult patient is delayed being defibrillated, their chance of surviving are dropping about 7 to 10%. And being that the rhythms that we're looking for, there's only 2 that will actually shock. The heart usually only stays in those 2 rhythms for roughly 4 to 8 minutes. CPR can kind of extend that. We'll administer medications that may extend that also. But yeah, usually about the 10-minute mark. Anything longer than that, we do have survival rates longer than that. But we kind of use 10 minutes as that rule.
So if you introduce those automatic external defibrillators early into the onset of the heart rhythm being abnormal, the likelihood of that person regaining a normal heartbeat is greatly improved. And so that was the reason why back in 1993 we introduced AEDs as part of our entourage or medical protocol so that we can provide a better service to the community.
So how exactly do these automatic external defibrillators work?
On a cardiac arrest patient, we will initially go ahead and attach the AED, size an oral airway, place a non-rebreather mask also at 15 liters. Green on button.
Start CPR. If you witnessed the arrest, push cancel.
Voice prompts are similar to what we're using now also. If it was a witness arrest, we can go ahead and hit the cancel button. If not, it'll count down 2 minutes for us. Once our fast patches are attached, we'll continue with our CPR. We're getting close to our 2-minute mark. I can either go ahead and override it or let it go ahead and finish out its whole thing. It'll prompt me here in about 30 seconds to go ahead and hit the analyze button.
Push analyze.
It doesn't automatically analyze. I can continue with my compressions if I have not reached 220 yet. Once I get to 220, we'll analyze.
Stand clear.
Machine
Analyzing now.
Analyzes
Stand
for about
clear.
6 to 9 seconds. If it finds VFib or VTAC, it'll charge itself up. During that 15-second charge, we'll continue with our compressions. Once it's charged,
Stand clear. Push shock button.
we'll clear the patient again. We'll push the shock button. And immediately following, we'll continue with our CPR.
Start CPR.
These AEDs also play a role in a new approach to CPR that the Wichita Fire Department and Sedgwick County EMS recently switched to. They call this approach the pit crew. When seconds literally count, first responders want to be as efficient as possible to save lives.
The basis of the pit crew is a triangle. Every single piece of the pit crew, so the BLS, what's called the sacred BLS triangle, where you can't mess with anything, is position 1, 2, and 3. And then you have a code commander, which is the paramedic on scene, a paramedic, which is the second person that came on the ambulance, and they do all the skills and stuff. And then we have BLS team leader, which is usually a company officer that it takes to run that whole thing. And everybody has specific things they have to do at specific times and specific ways. So it's really a choreographed event. Of course, the person on the above the head takes care of the airway and does some counting and stuff. And then those other two people, every 2 minutes, they shift on and off on delivering compressions. We use a metronome. You set it for 110 beeps a minute, and we just compress 110 times a minute. And then at that end of 220 beeps, so 2 minutes, we stop CPR. The paramedic on scene has under 10 seconds to make a decision, which that decision is shock the patient, don't shock the patient has a pulse, the patient doesn't have a pulse, and then we're back on the chest performing chest compressions.
This new method has proved to be much more successful than previous versions of CPR.
Here locally we had about a 10% roughly survival rate out of hospital, which average around the country is pretty good. When we switched to this new type system though, we actually had a threefold increase where now we have survival rates of about 30%. And that was important to us, but we wanted to make sure that we also had patients that were able to leave the hospital, as close to neurologically intact as they were. So we actually have about a survival rate out of hospital to leaving the hospital at about 90%.
Prior to the PIC crew model, it was generally the AHA accepted methods where you did 15 chest compressions, gave 2 breaths, 15 chest compressions, gave 2 breaths. What they found out prior to putting this in place, and a lot of the science behind it, is the more you pause and the longer you pause with those pauses is the less chance for the patient to survive. So and an elementary way of thinking it is if you ever did a hand well, primed a hand well out on the farm or something like that, it takes about 12 times of priming it, and then boy, the water just starts rushing. And every time you stop that, you have to do it 2 or 3 times and it goes again. And if you let it go for a minute, you might have to do it a whole bunch again for the water to come out. Same principle with doing chest compressions. Once you do X amount of chest compressions, 15 to 20 chest compressions, you start to move the blood. And the blood moves better, and it's more efficiently being moved the more chest compressions you do. But every time you stop or every time you pause, the pressures, and you lose the pressures in your chest, you lose the pressures throughout the body, and the blood's not moving as well.
The AEDs have proved to be useful even after crews have returned to the station from a medical emergency.
EMS has a team that they have that does what they call cardiac arrest annotations. Those annotations are done after every single cardiac arrest, and then they analyze the data. They determine what your CPR effectiveness was, both in timing, how many compressions you do per minute, and with our PIC crew CPR, we're real rigid about you have to do 110 compressions a minute with the metronome beep and all that. So they actually analyze that to see if everybody's conforming to our standard. Well, you can just be laser precise who you're dealing with. Well, 2B is having an issue with cardiac arrest, or 4C is having an issue with cardiac arrest. Instead of bringing everybody in for a yearly refresher, maybe you can send your refreshers out to every 3 years, and then you use that data to go to the individual hot pockets to where people might be having issues.
Captain File has seen firsthand how this new technology is saving lives.
We actually had a gentleman that was mowing in his backyard, went into cardiac arrest in the backyard, family found him. They actually started CPR prior to our arrival. Attached the AED, defibrillated once, actually went through another few cycles of CPR. We did end up getting a pulse back on him before we transported him to the hospital. It's amazing, how effective these are. You witness them go into cardiac arrest, compressions has started, if you can get your AED attached quickly, you can defibrillate them, and I've luckily had that, pleasure of, I don't know if you'd call it a pleasure, but somebody cardiac arrest in front of you, defibrillate them right, and they come back You know, I mean, it's something out of a movie that you wouldn't think would be possible, but, you know, they're awake, alert, and, you know, in essence, they were dead for those first couple minutes, and shocking them brought them back.
AEDs are just one more example of how technology is helping save lives.